Mr. Smith.
Hello.
My name is Monique. As you know, I've been taking care of you all day, so I'm just reminding you. Anyways, we're gonna go ahead and go through your discharge. We removed your PICC line, your central line. We waited the 30 minutes so you're able to go home now. It's not bleeding. So the bandage that's on there, you're gonna keep that on for 48 hours. We wrapped it up so that you can shower with it. So just make sure you leave that on. So you ready for discharge?
Yeah, I'm ready.
Okay.
My brother Aaron's here, so that
Okay.
way he can
Cool.
any instructions
All right. Hi,
in case
Aaron.
I miss.
Okay. Perfect. So he can just go ahead and listen, and if you forget anything, he can help you with that. So,
Yeah.
good. All right. So here's the medications that you're going to be taking.
Okay.
So first we have bacitracin. So that's what we've been putting on your hands for those lesions that you've been getting from chemo. So that's there. You're gonna put that on 2 times a day. It's just the ointment that we've been using. Do not put it on broken skin, and do not put it on longer than a week. Okay. So after that, we've got the Bactrim. So that's going to be taken 3 times a week, Monday, Wednesdays, and Fridays. And that is going to protect you against bacterial infections. And then we have a Cyclovir, which is going to be taken twice a day.
Okay.
Those are both by mouth, and that's going to protect you from viral infections. And then we have your Trazodone that you've been taking here for sleeping at night. So you're going to take that once at nighttime for sleep. And then we have promethazine. That is going to be for your nausea. You can take that as needed every 6 hours.
Okay.
If you're sorry, if you're not nauseous, don't take it. Okay.
Okay.
All right. And then we have your Atarax, which is your hydroxyzine. So you're going to be taking that every 8 hours as needed for anxiety. So those are your meds, and you're going to pick those up at the Walgreens pharmacy, which is your pharmacy, right?
Yeah, they're on Main Street.
Yes.
Yeah.
Yeah, perfect. All right. Do you have any questions about your medications?
No, not right now.
Okay, perfect. Okay, so since you started your chemo, we've been having you sit on the toilet to urinate and covering it when you flush, and washing your hands with soap and water, right? So so for the next 2 days, you're going to be doing that at home as well, okay? So, and use a separate bathroom if you can. Do you have any women in the home?
No, but I do have my own bathroom in my bedroom that I use. So no, there's no women in my house.
Okay, perfect. Just do follow those rules there, even with your own bathroom, but still cover the toilet and things like that. So, alrighty. Okay, so you had your neutrophils, which is your white blood cell count, come back low.
Okay.
So that's why we're kind of doing some of these things here, like some of your medications, the acyclovir and the Bactrim.
Okay.
So it came back at 0.32, where the normal range is 1.8 to 7.4. So you were low, and we've discussed this a little bit before, where you're now at risk, a higher risk for infections.
Yeah.
So because of the chemo, it destroys your white blood cells and it compromises your immune system. So that's why we've been wearing gloves and masks when we come into your room, to protect you from us.
Okay.
So, and then you've also been avoiding people, we've asked your visitors to make sure that they are not sick, or they have not been around anybody that's sick. No fresh plants or fresh flowers, fresh fruits or vegetables, no raw meat, and no sushi, because we know you love sushi, but we can't have sushi right now. So all those things that you're doing here, you're going to do at home. Okay. All right. Yeah. We know you love sushi.
I do.
Okay. So, yeah. And then your primary care provider will continue to monitor your blood cell, all your blood cells.
Okay.
And then they're going to kind of direct you on what to do.
That's fine. So what happens if I do get sick?
Good question. So we're gonna give you this thermometer. So we have a thermometer here. We got some gloves and stuff for you to use at home. But the thermometer you're gonna use to take your temperature twice a day, and you're gonna come into the emergency. You're gonna come back if you run a fever from 100.5
Okay.
or higher. So, yeah, we would like you to come back to the hospital. Since your immune system's compromised, we want to help you combat any infections so that you're not at risk for a potentially life-threatening situation. So, yeah, we definitely want that.
Okay.
Okay. All right. You will come in or notify your provider as soon as possible if you have any abnormal, like consistent diarrhea, bruising, bleeding, any falls, head injuries, difficulty breathing, shortness of breath, sudden severe headache, pain, trouble swallowing, sores in your mouth. That's pretty common, like with chemo, but we want to make sure that you're going to be able to swallow properly. Stiff neck or irregular heartbeat. Okay.
Okay. So when do I see my doctor again?
So we've set up your follow-up appointment with Dr. Johnson on March 13th, which is a Friday at 9 a.m. So we have that here on this paperwork.
Okay.
Yeah. So can you tell me what you should do when you get home, just so I can make sure that I've didn't leave anything out and that you understood?
No, that's fine, because that was a lot.
Yeah.
So yeah, I need to put the toilet seat down when I'm flushing. Urinate sitting down. Wash my hands after every use. Every time I go to the bathroom, and then I need to use a separate bathroom for 2 days, which I do have in my own bedroom. Then you go to Walgreens to get my medication. They're on Main Street. I need to avoid fresh flowers, plants, sushi, which I love very much. Fresh fruit and vegetables.
I'm sorry for that, yeah.
I need to check my temp twice a day. Make sure I'm not running a fever, because if I do, then I need to go to the hospital.
Right.
And then I need to keep my bandage on for 48 hours. A PICC line bandage.
Mm-hmm.
And then if I experience consistent diarrhea, bruising, bleeding in my stool or urine or wherever, or if I fall or have a head surgery or head injury, and then shortness of breath, or anything like that, I just need to come back and get that checked out.
Yeah, absolutely.
Okay. And then stiff neck, irregular heartbeat. Okay.
Yeah, and just make sure that the fever is 100.4
Okay.
or higher. So perfect. I'm glad that you understood all that. Sounds great to me. So, so then we talked about your medication. So I'm just going to kind of go over everything right now. We did go over your medications, and then the precautions for your immune system to help you protect yourself, and then how to protect other people from the chemotherapy that you received that's in your body, and the warning signs to look for, when to change your bandage, your follow-up, when to call your doctor, and then I think that's it. Do you have any questions?
No, I'm ready to go home.
Yeah.
If anything comes up, I'll give you a call.
Okay, perfect. All right. Well, thank you.
Thank you.
All right.